Hi everyone, welcome to my YouTube channel My Health and Me byfun. Please like, subscribe and share. Chronic obstructive pulmonary disease or COPD is a serious lung disease. It makes it hard to breathe. The airways in the lungs become inflamed. This inflammation makes the airways swollen. Over time, the airways get thicker and produce more mucus, making it difficult for air to move in and out of the lungs. This can leave one feeling short of breath. COPD is a progressive disease, which means it gets worse over time. There are two main types of COPD, chronic bronchitis and emphysema. Many people with COPD have both conditions. Chronic bronchitis is inflammation of the bronchial tubes, which carry air to and from your lungs. Emphysema is damage to the tiny air sacs in your lungs called alveoli. We will talk about these in the next video. COPD is a major health problem worldwide. It is the third leading cause of death in the United States. Although there is no cure for COPD, it can be managed with treatment. The main cause of COPD is cigarette smoking. The harmful chemicals in cigarette smoke damage the lungs and lead to inflammation. The longer you smoke and the more you smoke, the greater your risk of developing COPD. While smoking is the primary cause, other factors can also contribute to COPD. Exposure to air pollution, both indoors and outdoors, can irritate the lungs and increase your risk. In some cases, genetics play a role, making certain individuals more susceptible to developing the disease. Occupational exposure to dust, fumes, and chemicals can also contribute to COPD, especially over long periods. COPD often develops slowly, and symptoms may not appear until significant lung damage has occurred. One of the most common symptoms is a persistent cough, often referred to as a smoker's cough. Shortness of breath, especially during physical activity, is another hallmark symptom. As the disease progresses, one may experience wheezing, a whistling sound when one breathes. Chest tightness, as if something is squeezing your chest, is another symptom. In later stages, COPD can cause fatigue, swelling in the legs, ankles, or feet, and bluish discoloration of the lips or fingernails due to low oxygen levels. If you experience symptoms of COPD, it's essential to see a doctor for diagnosis and treatment. A doctor will review your medical history, including your smoking history and exposure to environmental irritants. They will perform a physical exam, listening to your lungs for any abnormal sounds. Spirometry, a lung function test, is commonly used to diagnose COPD. This test measures how much air you can inhale and exhale and how quickly you can blow air out of your lungs. A chest X-ray may also be done to rule out other lung conditions and assess the severity of COPD. Treatment for COPD focuses on relieving symptoms, slowing the progression of the disease, and improving your quality of life. Medications such as bronchodilators and inhaled steroids are often prescribed to open up the airways and reduce inflammation. Living with COPD requires ongoing management and lifestyle modifications. Quitting smoking is the single most important thing you can do to slow the progression of the disease and improve your lung function. Your doctor can provide resources and support to help you quit. Pulmonary rehabilitation is a program that combines exercise, education, and support to help you manage COPD. Regular exercise, even in short durations, can strengthen your respiratory muscles and improve your breathing. Eating a healthy diet, getting enough rest, and managing stress are also important for overall health and well-being. It's crucial to avoid exposure to lung irritants such as dust, smoke, and fumes. Get vaccinated against the flu and pneumonia to prevent respiratory infections that can worsen COPD symptoms. Remember, early detection and management are key to living a full and active life with COPD. If you experience any symptoms, don't hesitate to seek medical advice. Thank you for watching. Like, subscribe, and